Hi, I'm Amy, and I'm going to show you how to de-access and re-access a port with the port dressing change kit. I have my supplies here. I'm going to move my port access supplies to the side for a moment. Then I'm going to open up my port dressing change kit. I'm going to tear here, and the first step is removal. So I'll tear this open, perform hand hygiene, the provided alcohol. Now there are two masks in this kit, one for me as the practitioner doing the dressing change, and an optional mask for the patient if they have cold or flu-like symptoms, or if they want to watch you do the dressing change, you should have them wear the mask. And in this instance, Mr. Chester is fine, so I am going to just don the mask myself, and he will remain maskless. All right, I'm going to shuffle my supplies here for a moment. Although port de-access is not a sterile procedure, I am going to use the sterile gloves in the removal section here. So I'll put on my sterile gloves. Okay, now you're going to remove this dressing. I've already flushed the line, so I'm going to gently roll the dressing off of Chester here. And it's perfectly adequate to use alcohol to help remove this. You want to do a low and slow removal. Careful not to pull on the skin. Get this dressing off. All right. Now these dressings have the chlorhexidine patch on them. With the ports, you can remove the needle before you take the patch off. I'm going to grasp my needle and engage the safety device. I'll then dispose of that part in the sharps. I can use the saline syringe to loosen up the patch if needed. We're just going to slowly and carefully pull this away, again low and slow. This one's coming off pretty easily, but if it's sticky, just loosen it with a few drops of saline. At this point, I can remove my gloves. I've completed the removal of the dressing. I'm gonna put this in my trash here. All right, so now I'm ready to apply a new dressing. I'm gonna rearrange my supplies here for a moment. I'm gonna tear open the application section, remove my new pair of sterile gloves. I'm again going to do some hand hygiene here. So I'll perform hand hygiene. Now I'm going to open up my dressing kit. So it folds open here. Now I'm going to be careful here not to touch my sterile section here. Before I put my gloves on, I'm going to open the supplies I'm going to need onto the sterile field. So I have my two caps for my central line. I have my port needle. And then I have my sterile saline flushes. Now that all my supplies are on my sterile field, I can go ahead and don my sterile gloves. I'm going to move from left to right, starting with step one, which is to apply my chlorhexidine antiseptic. So I'm going to engage that and use a back and forth motion on the chest. to really clean the area where that dressing is going to be. So we'll do a 30-second scrub and allow that to dry for 30 seconds. Now while that's drying, what I like to do is get my port needle ready. Saves me a little bit of time. So I'll attach my caps. And I'll attach my saline flushes. And I'm going to need to prime this with saline. So pull back to get that engaged. I'm holding my flushes up so that air bubble goes to the top. Okay, and now that's all primed. It looks like my patient is still drying. I want to wait for that to completely dry before I apply step 2, the barrier. If you don't wait, that could cause some skin irritation to the patient. So it's really important to wait for that to dry. So we'll give him just another moment. And again, we're moving from left to right. So now it's time to do our skin prep, or barrier. And we'll go all around the area where that dressing is going to be on the skin, leaving the area around where you'll actually put the port needle free of the barrier. So now that we've got the barrier applied, we'll let that dry a moment before we get our needle ready. So at this point, our skin prep is drying on our patient, so I'm going to get our dressing ready. I've removed the chlorhexidine patch from the dressing. Now there are 2 ways to apply the chlorhexidine patch. You can apply that when you access with the needle, or you can slide that underneath the needle after it's in the patient. I'm going to show you how to apply it with the needle. So I will take the chlorhexidine patch and pull off this one section. Now there's a split here, so the needle slides there. So I'm going to take my needle and get it in place there with the chlorhexidine patch. Now these wings I can use to fold the chlorhexidine patch over and grab onto my port needle to access. At this point, I'm going to remove the needle cover and I will move over to my patient to access. Okay, so Chester is dry. I have my needle ready. I'm going to grasp the port firmly with my fingers, take my chlorhexidine and needle together, and access Chester with my tubing pointed up. Now that the needle is in, I'm going to hold on to these tabs here and slowly pull on this number 2 to adhere the chlorhexidine patch. I'm going to kind of press down on the chlorhexidine pad as I pull that out to get a good seal with that chlorhexidine patch. You want that patch to be around your insertion site. At this point, I'm going to flush and check for blood return. Chester has a little bit of a sluggish blood return, but I see some pink there. I'm just going to flush 10 for now. And at this point, I'm going to apply my dressing with my tubing pointed up or to the side, up preferred so that you don't get pulling. So I'm going to take my dressing and remove the backing. And then that single notch will be pointed up towards your tubing. Don't stretch the dressing, just try to tap it down around. And you want to apply firm pressure here to the dressing as you remove the borders to get a good occlusive seal here. Some firm, even pressure. At this point, we'll do the tab here. I like to peel back just half of it, and I like to slide it underneath. Firm, even pressure again to get that to stick, and then I peel back here. And then we'll do the date, time, and initials here, and stick this on the side. You want to make sure that you can see your chlorhexidine patch. That's going to protect your site. At this point, I will continue flushing the other 10 cc's of saline into Chester here. And now our dressing is in place.